Joining us now is Natalie Harp, a member of the advisory board for the Trump campaign and an ambassador for the Falkirk Center. So, Natalie, today that was that big testimony. A lot of Democrats were hoping that this would really raise maybe some issues about the Trump administration's response to the coronavirus outbreak, maybe something they can even use going into the campaign. What was your takeaway from what you saw today?
Well, it's super easy to be a Monday morning or Thursday morning quarterback. Well, but President Trump's being America's quarterback. And as Secretary Azar was talking about, it's like he had a chance when he was working for the department to do something, but it was the Obama administration that left the cupboards bare. And I really have a hard time when you're listening to him talking about, how dangerous hydroxychloroquine is. I mean, even approved drugs, anyone who's watched a drug commercial knows there's always that fine print about this could kill you, this could cause all these different things. Those are approved drugs. And as someone whose life was actually saved by President Trump's right to try approach, I have cancer, and he saved my life with an experimental medication because I failed approved drugs. So, there's both arguments here. I really think that needs to be up between the doctor and the patient. And so what Dr. Bright's doing today, it's like he's trying to take that right to try away from patients by trying to scare people. And really, it's like, what do you have to lose? As the president says, right now, there's no drugs that are approved for the coronavirus. So if there's an experimental medication a doctor thinks might work, why wouldn't you want to try it? If you don't want to try it, you don't have to. That's your choice. But Dr. Bright's trying to take that choice away.
And I'm glad that you bring up your own experience with cancer, because that is something that I hear from a lot of people. When we're talking about hydroxychloroquine, we're not saying that it comes in lieu of a vaccine or anything like that. It's for people who are in a very dire situation where they may not have any other path to go down. That's something that not only hydroxychloroquine is effective in doing, but also remdesivir. There are studies to show that both of those drugs could be effective for different people, too, in different circumstances. Some later on, some early on as a way to deter the coronavirus, things such as that. So when it comes to the right to try, how important is that for something like this?
Oh, I mean, 100% right now, because everybody now knows that fear that I had when you're failing treatments. I mean, here with coronavirus, there are no treatments. And that's a very frightening thing when you're on your deathbed, knowing that, you might just have to tough it out because there's no treatments for you. So President Trump has applied that same right to try approach. And I think that's what's given a lot of people hope. It's not false hope, it's real hope, because we're saying we're not just going to luck it out and see who's lucky or not. Here's some treatments that might work. And the president has done an all of America approach. I mean, you look at all the clinical trials that have started for treatments as well as vaccines. He's moving at the speed of Trump, and he's making the medical field move at the speed of Trump, and all this private enterprise coming together to try to find a cure so that we don't lose any more lives that need to be lost. So it's very easy for people like Dr. Bright to just be all talk, but the president's being all action right now, trying to find a cure, trying to find treatments, and we'll probably get treatments before we'll even get a vaccine. And that's helpful because, I mean, then you actually have a treatment when people do get sick.
Sure.
So that will help people now in between that time between now and getting a vaccine.
And when we talk about the coronavirus outbreak, too, we always talk about the idea that it's very fatal for people who are of older demographics, as well as people with underlying health conditions. And you actually wrote an op-ed recently in Town Hall that I want to read from. You said, while the left has demagogued on Obamacare to instill fear in the American people, President Trump has never wavered on his highest priority for our health care, protecting the coverage of pre-existing conditions. And that's also a demographic of people who could be very much so affected by the coronavirus outbreak. So can you speak a little bit of what you meant by that?
Right. I mean, no one has done more for pre-existing conditions than President Trump. I mean, Obama, he used it as a talking point. But let's face it, everybody lost their doctors and their plans. And who needs to see a doctor and needs health insurance? People with pre-existing conditions. So it was all talking points to President Obama, but to President Trump, he's actually done action. Even before this coronavirus pandemic, he passed the right to try. Look at everything he did for the opioid epidemic, trying to not only help people with addiction, but to try to find new cures for pain management, which no one had done before. So he really put people with pre-existing conditions on his short list instead of going to the easy things first. He's like, no, I'm gonna help people with terminal illnesses. I'm gonna help people who've been waiting on donor lists for so long in terms of kidney care. So he went for that first, and now everybody's seeing, even with this pandemic, what did he do for people with pre-existing conditions? He immediately closed down the country when we started realizing the coronavirus could come here and infect people. He started social distancing, all of these different things to help people with pre-existing conditions. And he's continuing that even as we open the country right now, because, we can't be like Rip Van Winkle and just like go to sleep for a year until the vaccine comes out. I
Right.
mean, you're going to wake up in a socialist country with no rights anymore. But you can do both at the same time. And that's what I appreciate about how he's fighting for people with pre-existing conditions, putting us first, not just talking about us to score political points.
Right. And I think you're right on to say, too, that this is an easy thing to look back and say, we should have done this. But I mean, even if you look at some of the international institutions who were tasked with giving us the right information, such as the World Health Organization, they were wrong for a lot of it as well. And
Right.
now, because of those actions, some say that they were parroting Chinese propaganda. The United States was put in a position where they were playing from behind as well. So I don't think it's right to blame it on any one individual or even in the information at the time, because at the time, a lot of our health officials were acting on information that they thought was good coming from an institution, the World Health Organization, that they usually would have trusted. So I think you're right to say that hindsight's 20/20 when it comes to this issue. Natalie Harp, I really appreciate you coming on tonight. Thanks for joining us.